Did you know that nearly 10 million young people reported they've been consumed alcohol in past 30 days? The teens years are a time for studying out and experimentation. Parents always try to prevent their kids from the bad contagious habits such as drinking and drug abuse. The lections about the fatal cases and fearful pictures do not intimidate the modern teenagers anymore, oppositely make the poison more attractive and obscure. Addiction are often characterized by compulsive use that's outside of parents' control. The addicted teenagers often don't even make a deliberate effort to oppose them they're abusing. It's often hard for them psychologically and physiologically, even though the poor suffering teens want to give this up. Alcohol is the second most used psychoactive drug. It slows thinking and impairs physical activity. It often causes dependence, which is a state of psychological and physiological needs to take more of a drug after continued applying. So, alcohol impairs the parts of the brain responsible for controlling inhibitions and making judgments, which make it an euphoric effect. Giving control back means providing the person with in-depth, ongoing, comprehensive therapy. Teens who get help like this can recover, although they might need to spend the rest of their lives defending with sobriety and ensuring their bad habits do not return. The rehabilitation problem starts with detoxification, which ensures no more drugs in the bloodstream.
In general, inpatient facilities are considered a good choice for teens with a long history of addiction and a low level of motivation to succeed in rehab. These are the teens who don't really believe their addictions are a problem, and they're adept at hiding their behaviors from their families. It would be very easy for these teens to start using drugs once more, and it would be very hard for families to provide appropriate help when they are so easily convinced that their addiction is not as serious. In an inpatient program, teens will have the supervision they'll need to ensure their sobriety, and they'll be encouraged to stick with therapy until they have a firmer grip on the tools they'll use to avoid alcohol. Therapy can take many different forms, but often teens are asked to think about the triggers that lead them to drug use. For some teens, peer pressure plays a role. For others, depression or anxiety is to blame. Once the hidden sensitivity is exposed, the teens can develop sophisticated tools that could be used to soothe the trigger long before a relapse takes place. Avoidance, mediation, visualization, or just straight talk could be tools teens could use to diffuse a situation that might lead to drug use. Cognitive therapy techniques like helping the teens recognize what tends to precede and follow their episode of alcohol use are often used to address alcohol abuse in teens. Some treatment programs include drug testing. 12-step programs like Alcohol Anonymous are individualized drug counseling methods. Motivational enhancement therapy encourages the teen to increase their desire to participate in therapy. Teens can be healed or can be not, based on their deliberate effort, family support, facilities, special programs, and alcohol treatments. But if you don't want to participate in these programs or don't want to be a part of this community of alcoholics, please do not drink. Stay safe.